Director for Northwest, and I'd like to welcome you to today's session. I just want to remind you first that the library is still remotely open and here to help you. But one of the things the library is always concerned about is having the importance of the best and most reliable information. So we're really pleased to be able to bring to you today an expert I can't even say it now, an expert to talk to you about COVID-19. Dr. Cathy Triosi is one of Houston's leading epidemiologists. She gives many interviews for public radio, CNN, and even far away as a news outlet in Australia. So you might have already heard her voice. She's a professor at the UT School of Public Health. Moderating today's session, who will also give you some information on how the Q&A will be set up, is Javier Perez, one of our library staff members. And so without further ado, let me welcome both of them.
Thank you.
Thank you very much, and good afternoon. So the way it's kind of going to work is I'm going to have some questions that I have for the doctor. After I answer my questions, if none of the answers that you were looking for the minute, you're welcome to ask the questions in the chat. I'll read them out loud and we'll go from there. Are you ready, Dr. Triosi?
I'm ready.
Excellent. So I guess the first question is we're really going to go into it is what does an epidemiologist do? And why is that so important right now and being aware of public health issues public health issues right now?
Yeah, so the epidemiologist comes from the word epidemic. And so it's a study of why diseases happen in populations, how they happen, what causes them. And you can study many different aspects of disease. I happen to specialize in infectious diseases, but there are people who do cancer epidemiology, heart disease, any sort of disease you can think of that people study. It is part of the core of public health. It's one science that is unique to public health. There's not an analogous one in medicine, whereas there are with other disciplines. Sorry, my kitty wants to join. This is Mo. So public health right now with the pandemic is really important. Public health is the mission of public health is assuring conditions where people can be healthy. So it's not like when you go to your doctor and he or she takes your history and prescribes a medicine just for you. Public health deals with communities. And with the pandemic, obviously we need our medical people as well. But the two goals of public health are to prevent disease and promote health. So public health is particularly important right now. It has traditionally not been funded enough, and we're seeing some of the consequences of that in our response to the pandemic.
So you mentioned communities and the discussion of how public health does affect a community, specifically in the Houston community. Do you have any comments on the current state with COVID-19?
Yeah, in Harris County, we are still in level 1, which means people should be staying home and not going out unless you have to, no mass gatherings. Now, statewide, we have a mask mandate still, but the governor, I believe it was last week, opened up restaurants and businesses to 75%. In Harris County, we've actually been doing pretty well. We're still seeing more cases per day than we would like. And one of the metrics that we use to tell how well we're doing in controlling the virus is called the test positivity rate. And that's of the number, if you test 100 people, how many of them are positive? And the goal is to get it below 5%. And we have been as high as 25%. So right now it's about between 6 and 7%. So we're not quite to the 5% that we want, but much better than that 25% we were at.
And to get that lower rate, that under that number, what are some reasonable precautions students should be taking as they return to class or in-person class or even in everyday life?
Right. So we don't have a vaccine yet. We don't have any drugs you can take to keep you from getting the virus. We do have some things if you're already infected. And so the only way we have of preventing the virus from spreading are called non-pharmaceutical interventions. You know, they're not drugs. They're really public health measures. And those are wearing a mask. We know that that protects both the person who's wearing it as well as others. And that's the what we call physical distancing, social distancing, staying at least 6 feet from other people. And then environmental sanitation, wiping down surfaces, washing your hands, although you should be washing your hands for other reasons, not just because of coronavirus. And we, you know, at first we weren't sure how much that environmental spread was contributing to transmission. Now we don't think it's that much, but still, you know, you should be washing your hands anyways, and it doesn't hurt to wipe down surfaces. Most of the transmission takes place through the air, so, you know, keeping yourself away from others who might be infected and wearing a mask are really the main things we can do.
So you mentioned earlier that we're beginning to open up a little bit more in the Houston area. We've seen restaurants, stores, grocery stores, really seeing a more influx of people. But one thing that we're not seeing is bars. Do you have a kind of an explanation for that, or a reasonable explanation to why bars are still such a dangerous place for this epidemic?
Yes. So when our bars in Texas opened up back in June, May, whenever it was, we saw a big increase in number of cases. Now, there were probably other things that this was due to, but what makes bars particularly hazardous is, first of all, you tend to be there for a long time, you know, hours, versus if you go out to eat, you know, you might be there an hour, hour and a half. Secondly, the whole point of going to a bar is to be social. So you're interacting with a lot of people, unlike at a restaurant where you may go with your friend or family or whatever, but you're just at your table. You're not interacting with others. Third, bars tend to be loud, and so people are speaking loudly to be heard, and we know that transmits the virus. And then there's the alcohol. You can't wear a mask when you're drinking, and alcohol, this may come as a shock, but it tends to, you know, get rid of some of those inhibitions. So you may not take the precautions that you would if you hadn't had that second drink. So those are all reasons why bars are such good places to spread the virus, and why the governor has not opened them up yet.
Okay. Now I'm going to ask you kind of not complicated, but a compound question, we'll call it. And it's in regards to, you know, something that's on the news on a regular basis. You're hearing people talk about it, and that's the vaccines. How exactly does a vaccine work? Because you hear different stuff coming from different people. Everybody has a Facebook group that, you know, seems to have an epidemiologist of their own talking about the vaccine. And how likely is that to be available here in the U.S.?
So vaccines work, you know, when your body, for the most part, with most viruses, when you're infected, your immune system recognizes that virus or bacteria, and it gears up and it makes antibodies. And the next time it sees that virus or bacteria, it is ready to go. It's got those antibodies and T cells, and, you know, and that's why we only get measles once or mumps once. Now, there are some things we do get more than once, but, you know, in general, it's, you know, your immune system remembers. So what a vaccine does is trick your body into thinking I'll use coronavirus. It's using something that looks like the coronavirus, and but won't make you sick. But your immune system is tricked. It makes antibodies, and if it were to see the real coronavirus, it would be ready to go. It would get rid of the virus before you got sick. Now, so vaccines have been around for a long time. There are over 100 vaccines right now in various stages of development. And to develop a vaccine takes a long time Because first of all, we're not always sure what will work, what exactly, let's say, what proteins from the virus will trigger that immune response that protects you. Secondly, we inject vaccines into healthy people. So we want to be absolutely sure that they're not going to do any harm. If you're sick and a drug is prescribed and maybe it has some side effects, you will put up with that because you want it to treat whatever it's supposed to treat. Vaccines we put into healthy people. So there are different phases of vaccine development. There's phase 1 where you give it to just a couple. I mean, there's a lot of work in the laboratory first, and maybe animal studies, depends. Phase 1, you put it in a few people, make sure that nobody drops dead, basically. Phase 2, more people. But again, you're talking 20, 30, not that many people. And the phase 3 are those big trials with tens of thousands of people that are going on right now with several different potential vaccines that and those are to see not only is it safe, so you're looking for side effects, but you're also looking to see, does it work? Now, we like to think that vaccines work 100% of the time, but no vaccine works 100% of the time. Some of them work 98. I mean, you know, it's pretty darn good. For this vaccine, however, the bar has been set relatively low at between, it depends on the vaccine candidate, 40% or 50%. What that means is, let's use 50%. Half of the people who get the vaccine will not get severely ill or die compared to people who get the placebo. Now, that doesn't mean that they won't get infected, and it doesn't mean that they won't transmit disease. And that is why there is concern about how effective a vaccine will be. There is also concern because a number of people are saying they're not going to take it, or at least not take it right away. And so the purpose of a vaccine, besides protecting you, who's been vaccinated, and you, my kitty, is to get herd immunity. Herd immunity is when enough people in the community are immune to the let's call it let's say coronavirus. So that, and that can be either because they've been infected naturally, they got over it, now they're immune, or they were vaccinated. So the idea is you need probably about 80% of the community to be immune, again, either through infection or vaccine, to protect those other people who can't be vaccinated for various reasons, or and that there just aren't enough susceptible people that the virus can spread.
So 2 points that I heard in there was, you know, there's still a risk or danger even with the vaccine being implemented into the US. So would masks be something that's implemented that you feel would be a strong, you know, deterrent towards the virus? Is that something that, you know, you want to continue going forward, even if we do get vaccinated, even if we do get to that herd immunity? Are masks something that should still be required in public spaces?
Yeah, I think we're going to be either requiring or recommending masks for another year or so. Again, so let me go back to types of vaccine. There are 3 different types of vaccine that are being developed right now that are in these big phase 3 trials. 2 of the kinds of vaccines have never been used in humans before. Theoretically, they work, but we've never actually tested these platforms for vaccines in humans. One of the kinds, like Moderna, you've probably heard of, requires that the vaccine be kept at minus 80 degrees Celsius. That's minus 100 or something Fahrenheit. There's no other vaccine that has to be done for. And you can imagine the problems in distributing a vaccine that you have to keep in laboratory grade freezers. We're also concerned about supplies. Whatever vaccine is licensed will probably require 2 doses. will we have enough syringes and vials to put the vaccine in, and all the supplies that you need for distributing vaccine. That's why I didn't answer this before, but that's why it's very unlikely we will have a vaccine before the end of the year. Most scientists are saying mid next year. And then masking will, it's not going to be all, we have a vaccine and then the next day everybody's vaccinated. It's going to take a while, even without these other issues that I talked about, to just, it'll take a while to distribute the vaccine. So yeah, we'll be wearing masks for a while.
So before I go into any other questions, I do want to look at the chat and open it up for anybody who would like to submit a question for the good doctor or has something that they would like to say. Now would be the time to do it. I'll give it a little bit of time here and hopefully get some questions in. We did have one question. I think we did meet it though. It was the population was asking about whether the population would still be recommended to wear masks.
Yeah, although it's not that vaccines don't prevent anybody from contracting the virus. It just may only protect half of the people who get the vaccine from contracting the virus. And it's not even that. It will protect people. It will protect 50% of the people from either severe medical consequences or dying. So that's good. But it may not protect those people from getting or people from getting the virus and giving it to others. And that's why masks are going to be necessary.
So I do have two questions. I'm going to go with one because we are still talking about vaccines in regards to the populace. It's, do people who have contracted the virus and have recovered need to take the vaccine?
That's a good question that we don't know the answer to. One of the things, so I mentioned earlier, measles and mumps. You get vaccinated, you're immune for life. There are other viruses that you're not immune for life. Your body just doesn't make as good a response, or for example, with influenza, the virus keeps changing and fooling your immune system. With coronaviruses, there are other coronaviruses. There are 4 that cause common colds, and then the original SARS, and another one called Middle East respiratory virus, MERS, that's linked to camels. We don't have it in the United States. With those other coronaviruses, same family, but slightly different, it looks like immunity doesn't last very long, maybe up to a year. It depends. And we're just not sure with SARS-CoV-2 how long immunity is going to last. Will a vaccine, so we do have a few examples of people who have gotten infected and then got reinfected months later, but the vaccine the virus hasn't been around long enough for us to really, have long-term studies on it. So will you need to get a vaccine every year, for example? We're just not sure.
And so before I go on to some of the other questions, I do want to touch back on one, and it was just a real quick description. You did mention there were different types of vaccines. And the question is, what other 2 types of vaccines are out there?
Yeah, so there are 3 basic types, platforms that are out there. The Moderna with the messenger RNA is using RNA into, so it's coded for part of the virus that, for a protein of the virus. You inject the messenger RNA into your body, and your body recognizes it and starts making that protein of the virus. Not enough to make you sick, it's just one protein. And then, but your immune system says, this isn't right, I'm going to make some antibodies. And so that's the idea with mRNA. There are also 2 vaccine candidates in phase 3 trials. One is the Johnson & Johnson one, and one is AstraZeneca, that use another virus that causes a common cold. They're called adenoviruses. They're very mild, and part of the RNA for coronavirus is put into these adenoviruses, and it tricks the adenovirus into producing the coronavirus protein once it's in your body. Again, never been used in humans. Then the third type of vaccine that's out there, Novavax is one of the Novo Vax vaccine is in phase 3 trials, is just taking a protein from the virus. That's how traditionally vaccines are made, either using a protein from the virus, or there are some vaccines, again, like measles and mumps, where you get a weakened strain of the virus. But so.
Thank you. That was a good bit of information. A really good and very common question is, what plans are in place to help senior citizens and vulnerable population until a vaccine is available? So what out there is Houston doing that you know of to really protect the most vulnerable to this disease?
Yeah, we saw at the beginning of the pandemic, as in the United States at least, we saw a number of deaths in nursing homes and other long-term care facilities. We know that that there are certain risk factors for having more severe disease and dying. One of them being age, and then those who have underlying medical conditions. And there's a whole list of medical conditions that increase the risk you will have a severe outcome. Not that we haven't seen severe outcomes in young people with no underlying conditions, but it just ups the odds. If you look at the United States as a whole, 56% of the United States have one of these underlying conditions, and that's not counting age. So the nursing homes and long-term care facilities have, although you might say they didn't do the best job early on, now are really implementing very strict infection control procedures. The problem is that this is social isolation for our senior citizens, and that just isn't good psychologically. And so that's what people are dealing with, the pros and cons. In terms of other vulnerable populations, we know that both infection rates as well as hospitalizations and deaths are higher among African Americans and Hispanics. It's not that they're more likely to become infected if they are exposed, it's just that they're more likely to be exposed. They, because of our socioeconomic stratification, Hispanics, other people of color, are more likely to have what we call now essential jobs. They're not paid like they're essential jobs, but they are the ones who, are working in the grocery stores and various places where, like, I can work at home and not be exposed. But once they do so they're more likely to get infected because they're exposed more. Once they are infected, we know that some of these underlying conditions, diabetes, hypertension, are asthma, are more likely, that those populations are more likely to have those underlying conditions. And then there's all of the what we call social determinants of health. These are non-physical things that affect your health, and certainly access to care is one of them. One of the hallmarks of this virus is that about 40% of people who are infected never show symptoms. And they can still spread the virus, but they feel fine. They don't even know they're infected. You can also, even if you're going to develop symptoms, you can spread the virus for a couple days before you start feeling sick. Now, if you have a job paying minimum wage, you don't have any sick leave, your family, it's either you work or there's no food on the table, and you're not sick, are you going to want to get tested and find out you have to quarantine for 14 days, and that's 14 days without a paycheck? And so what we've seen is sometimes people don't want to know that they are infected because of this reason. So that was a long answer to your question.
No, that was good. But, and I'm going to continue with some of the questions on here, but I do want to, add in something. You mentioned earlier about the nursing homes, how at the very beginning there was that struggle, and the evolution through this process, they've picked up and they've adjusted. One of the things that I've seen the most is that for the first time, we're seeing science play out as science is. There's constant evolution of information. There's changes because we learn more as time goes on. And some people may feel insecure or may, frightened by that, but that's part of that process. It's just now that we're seeing it in such a publicized way that we haven't before.
Right. Well, I mean, this is how science works. This was a new virus we had never seen before. We've learned a lot in the 8 months that it's been, 9 months almost. So not only, I mean, yes, you're absolutely right that that's how science works. We have a theory, we test it. Oh, not quite right. We go back and adjust, more information comes out. But it's also the science is being played out in the media. So there's one paper that hasn't been peer reviewed and that gets a headline. And then, so that has complicated our response to the virus as well.
I have another question here, and I'm going to state it right here. It says, currently, Florida is starting to really relax their restrictions. If I'm not mistaken, they will soon open back to almost 100%. Do you think this is wise? Secondly, with such a high survival rate, 99.5%, do you think that we are overreacting in the response? Now, I know you're not in Florida, and you may not be 100% familiar with Florida's response to it, but based on what you've heard and the knowledge that you have, how would you answer that?
So what we have seen is that when states start to reopen, the number of cases go up. Right now, we are, because people my age are not out there, we are taking precautions. In Harris County and indeed in Texas and in other states, I don't know about Florida specifically, the highest percent of cases are in 20 to 29-year-olds. Now, they're not likely to die, although there certainly have been. And I will say that the case fatality rate for the United States is almost 3%. It's not 99.5% recover. And we are also learning it's not just you get sick and either you're unlucky and you die, or you get sick, you get over it, everything's great. We are learning about long-term consequences of the infection, particularly heart-related, but other organs as well, including kidney. People have had to go on dialysis, and neurological. There's basically no system that can't be affected by this virus. So death, although that's the worst possible outcome, is not, the only thing we should be looking at. And Sweden, you may know, of all countries, decided they were not going to put any restrictions in place and go for herd immunity. It hasn't worked out so well for them. They've had a very high death rate. If you're 20, maybe you don't care if those of us over 65 die, but it's important to me. And as I said, 56, over half of the country has a condition that would make them more likely to have a severe outcome. So was that both parts of the question? I can't remember.
Yeah, I think you hit.
Okay.
Yeah, I think you hit on everything.
Okay.
And one more, would it be to the benefit of the individual to try to build up their immune system? And if so, what recommendations can you share with us? So, on social media and on the news, you're hearing all these, teas and herbs and all this kind of stuff. Is there anything out there that you feel really would make that difference? Or are there vitamins or supplements that you feel would have a positive effect, or is it negligible in the long term?
Yeah. Well, first of all, I'm not an MD, so this is not medical advice. But building up your immune system is a good idea anyways, and we know that enough sleep, proper nutrition, exercise, reducing stress as much as you can all contribute to helping your immune system work better. There are some studies showing that vitamin D may have an effect. on protecting people, on shoring up your immune system and protecting you from getting infected. Not completely, but somewhat. But the jury's still out on that one.
And I know this might be anecdotal, and this is my question, and I've heard about it, and I see that you have your gorgeous cat with you, so it is a cat question.
Yes.
There has been transmission of the disease with animals. How widespread is that? Is that something that we should, really be concerned about, or is that so minimal that it's a 1 in a million chance that, your lovely pets can catch it and then you catch it in some way?
Yeah, you're right. There have been some cases, but they're so rare that each individual case gets a headline in the scientific literature. Although in the Netherlands, they're having mink apparently can get the virus. So they're having outbreaks on mink farms. So far, what has happened is the animal has gotten it from the human, not vice versa. So there are recommendations that if you should get infected, and you have a lovely kitty like Mo here, that you might want to stay away from your pet. But you can tell how affectionate Mo is. I don't know how I would do that. So again, it's very, very rare. It's just not something we worry about too much.
So I don't need to go buy some kitty and doggy masks for my pets.
Right.
Have them
Yeah,
walk
good
around
luck with that.
If anybody else has any other questions, now would be the time. I think we've hit everybody. If you feel like your question wasn't answered to the fullest, you're welcome to reach back out. Oh, look, we do got some more questions. There we go. It's more of a comment, I think it is. So this means we don't know for sure that vaccination will help people not get COVID, since there is no long-term immunity. I think you talked to that a little bit earlier, but if you can kind of clarify.
Yeah, well, we don't know whether there's long-term immunity with this particular coronavirus. As I said, with other coronaviruses, there is not, but this is a different virus. I mean, same family, but it's still different. And, the thing is, the first vaccine that's licensed may not be the most effective vaccine. We're only trying for 50%. Better vaccines will come along. So, eventually vaccines may help us. Will help us if enough people take them. But at first, because the standard for a vaccine working for this virus is 50, one of them, it's only 40% of people will not get severely ill or die. It doesn't mean they won't get sick.
Okay, I think that kind of reaches into the next question. Since we think this virus was around for an extended period of time before we noticed it, do you think we are getting to a point of herd immunity since our cases are starting to flatten out, or is that flatten out due to what we've been doing so far?
Yeah, there have been some studies done in the United States and other countries. In the United States, looking at how many people have antibodies. So this includes people who never knew they were sick. And it ranges from 1% to 6.9%. The highest that's been found is about 10%. As I mentioned, we need about 80% to have herd immunity. So we're not close yet.
Okay, and I'm going to two-part this question. It's in regards to being asymptomatic. The beginning of it is, why are so many people asymptomatic to COVID? And if you are asymptomatic, will you get over the disease? Will it just be in your system that it will continue to spread? I think is what they're asking.
Right. Very good question. We have no idea why so many people are asymptomatic. Here's a virus that goes from no symptoms to killing you, the whole gamut. And we really don't know. It may be, and this is just a theory, but it may be, I mentioned there are 4 coronaviruses that cause common colds. In fact, if you look at people who have colds, about 40% of them are due to coronaviruses. There's lots of other viruses that cause colds. So they're very common. It may be that some people have made immunity to those cold-causing coronaviruses that helps protect them against this coronavirus. But that's a theory. We don't know. We really don't know why that's the case. There may be genetic, some people have different genetics, and it may be that one protects you. We just don't know. And I forgot the second part.
If they are asymptomatic, will they get over the disease, or will they be able to, does it continue to pass even if they are
Right.
asymptomatic?
So no, it does not. There are certain viruses like hepatitis C that if you're infected, unless you get treatment, you're going to have that virus in your blood for the rest of your life, basically. You will get over this whether or not you have symptoms. There are people who have symptoms for a long time, months and months. Now, again, the virus has only been around for, the first case was reported the end of December, so 9 months. But people who have symptoms for months, they're called long haulers. However, they don't still have the virus. It's just the virus has caused some damage into their system. And the percent of people who have that is actually quite high, maybe 20 or 30%. So back to that question about just, the death rate isn't high, so let people get it. It's not, again, not you die or you get over it. There can be long-term consequences.
One more in regards to vaccination. It says, does BCG, I'm not familiar with that term, vaccination make individuals less susceptible to coronavirus?
So BCG is a vaccine that is not used in the United States, but used in other countries that protects you sort of. It's not actually a very good vaccine. Protects you sort of against TB. And there have been observational studies that in countries that practice BCG vaccination of children, that those children have a lower rate of common infectious diseases. So, and this is part of epidemiology, you can think there might be some other explanation for that. Maybe countries that do BCG vaccination have more money to spend on other protective things as well. But that observation has been made. So one of the vaccines that's in trials is a BCG vaccine, but there hasn't been, when people have looked at those countries, as I said, there's just not a whole lot of evidence yet that BCG does actually protect you against coronavirus.
Another question that we have is, will we have to take the vaccine the same way we take a flu shot, such as getting a shot every year? I've heard, and I'm going off on my own here based on this question. I have heard before that, there's a process where it's one shot, one day, and then 24 to 48 hours, you take the second shot. Is it going to be, I guess, how would that work is the full question.
Yeah, it's actually probably a month later, 28 days later. There are a number of vaccines that we get that you need to have more than one dose. Whether we're going to need to have it every year is going to depend on two things, and we just don't know right now. One is how effective the vaccine is, and two, these coronaviruses are RNA viruses. Viruses can have DNA or RNA as their genetic material. RNA can change, can mutate, and this is what happens with flu. This is part of the reason why you need a flu vaccine every year. The virus changes enough that your immune system doesn't recognize it. The coronaviruses don't change as quickly as flu viruses, but they can change. So, I mean, the answer is we don't know. We just don't know whether we're going to need to have a shot every year like the flu shot or not.
So this is a rather broad question, and I think it applies not just to going back to campus, but going to any public space or group space. Is it safe to go back to a campus, or should students continue online? I do want to say, I think, that's something that the student has to make a decision on their own preferences and choices, but based on the evidence, based on the facts, what is your kind of mindset on that?
Boy, going back to school is a big issue, and even more so at the K through 12 level. My oldest grandchild started first grade this year, and she started at the kitchen table. My daughter sent me a picture. It just about broke my heart. You know, first grade is about playing with your friends, and yeah. At the college level, online learning can be done much more effectively than at the first grade level. I think that it's going to depend on a number of issues. One is where you're located and what the pandemic looks like in your area. So parts of the country right now are doing quite well, other parts of the country not so well. But we have seen, as colleges have opened up, that there have been outbreaks of the virus. Now, those college administrators who thought you could bring 18-year-olds back to campus and not have them socialize, I don't know what they were drinking, because I think anybody could tell you that wasn't going to work.
And there really is such a difference between a university where there's dorm rooms and the social situations are so different versus a community college. And I do want to piggyback real quick on that question, though, because I do want to state HCC does have a COVID page, if you're interested, on their main site with all the things that HCC is doing to prepare and clean the campuses for the labs and for the students that do go back to some of the classes, or for any of the staff that does as well.
Yeah, and it really is going to depend. I told you how to protect yourself. Wear masks, stay at least 6 feet away from other people. Don't, outside is better than inside. Avoid crowded conditions. So if you are able to attend class and not be sitting right next to your classmate like you would have last fall, then it's and there are certain classes. I'm teaching a class this semester. It's totally online, but lab classes, that's hard to do online. So maybe you need to prioritize, or the campuses need to prioritize the ones that do have to be face to face.
This is a really good question. I think this is a question everybody asks. Anybody who have in their family who's in the medical profession, is what type of mask does the doctor wear when they're going? What masks are y'all using to protect yourself?
I had one on the table, but I moved it. That's a really good question, because we talk about masking and there are a lot of different ones out there. 3 layers is better than 2 layers is better than 1 layer. You want to make sure that it covers your nose to your chin. Those chin straps do not protect you. The virus is not transmitted through your chin. You want it to fit, not tightly like it's digging into your skin, but you don't want it to be gapping here. So the ones that I wear mostly, because I have a ton of them, I have one that looks like a cat. I have a pocket to put a filter in, and I just use coffee filters. And the ones, as I said, the ones that I have more layers. Now, there are different types of material, but there was just a report last week showing that basically any kind of fabric works. The more tightly woven the fabric is, the better it works, but then you can't breathe as well. So, there's a trade-off. Obviously, you don't want gauze, you don't want holes. I'm a big knitter, and I saw a pattern to knit a mask. Like, come on, that's not going to work. I can guarantee it. So, more layers, fitted properly, a filter, oh, I know the other thing I was going to say is a lot of mine have that wire right here for your nose, to sort of pinch it there. And when I say pinch, it doesn't hurt like pinching. It just makes a closer contact.
We have a couple more questions. I know we're getting close to the end, so I'm going to try to hit as many as I can before we end. If we don't get to your question, I do apologize. So some people live alone. If the virus is contracted, what are the recommendations when it comes to taking care about the person itself or pets? I think we kind of touched on the pet part earlier, but if somebody is alone, what is the best recommendation for their self-protection?
It's going to depend. Are you feeling a little achy? You go to bed for a couple of days, drink plenty of liquids, the usual advice you get. But if it's more than that, you really need to call your health care provider and get recommendations for what you should be doing.
Let's see here. This is an interesting one. It says, good afternoon, I have a question. Do you think that the virus in any way could alter our DNA or some other codification of our system? Thank you very much. So I'm assuming small alterations, not growing an extra arm or changing your genetic makeup, but what effects can it have on your system in regards to your DNA?
So there is a virus, hepatitis B, that actually can integrate into your DNA in your liver, and that's why hepatitis B can cause liver cancer. This virus does not do that. RNA viruses don't do that. And so the simple answer is no, it can't.
Okay. This is a little vague, so I'm going to try to interpret as best as I can. And if I'm interpreting it wrong, please let me know. It says, what can we do going forward after the vaccine is available? I assume they mean once the vaccine becomes available, what steps should they take to get the vaccine? And what steps should they notify people about, their exposure, or if they're vaccinated, will they be allowed in public in an easier way? Or I think that's what the question is asking.
Yeah, so again, we're not really sure. People right now are working on, I was at a meeting this morning with the Surgeon General of the United States, and he was talking about priority populations for the vaccine. It will be healthcare workers and first responders first, and then probably elderly and high risk. After that, I don't know. I mean, nobody knows. So after it's going to take months to produce enough. Once we have a good vaccine, it's going to take months to produce enough vaccine and get it out to people. You need a whole distribution chain. And then if there are 2 doses, which there probably will be a month apart, that just adds to it. That's why I'm saying we're going to be masking for a while and keeping up these physical distancing recommendations. Was there more to the question? Sorry. Distracted me.
That's good. That's good. And this is one other question about the vaccine. It's the cost of the vaccine. They do state it might not be a question for our guests, but the cost of the vaccine would it be affordable for the general population? Will the government in some way kind of subsidize it, I guess would be the term, or just make it easier for people of low income, since it is affecting, as you mentioned, low income families?
Very good question. And the answer is we don't know. There, and some of it's going to depend on what happens to ACA, which, as you may be aware, is going to be in front of the Supreme Court right the week after the election. Right now, the Affordable Care Act covers immunizations. There's some requirements there, but basically covers it. There is talk. So if ACA is struck down, then your insurance company would not have to pay for it, and that's for people who have insurance. Texas has the largest percent of people who do not have insurance coverage. There is even talk that Medicare for people 65 and older will not cover the cost of the vaccine. So you are absolutely right that's, besides the distribution question and the science of will it work, that is a really big question.
Currently, there is so much, and this is a question again, currently there's so much information going around about COVID and vaccine due to religious skeptics and lots of misinformation about vaccines. It seems a lot of people are saying they will refuse a vaccine. Do you see this being an issue, and what kind of issues could this cause for the general public?
Yeah, it is going to be an issue. And I think that there are 2 groups of people who are going to be either refuse or be hesitant about taking the vaccine. One are what we call the anti-vaxxers, the people who are against vaccines for everything. That's actually a small percentage of the population. A bigger group of people who are going to not accept a vaccine at first is due to the politicalization of this vaccine development and concern that it is being rushed through. Perhaps a risk communication person should have consulted on Operation Warp Speed name. It might send the idea that you aren't doing the testing you should to do. And then we've seen the politics that FDA and CDC have bowed to political pressure and changed the science on some recommendations. And so, the short answer to your question, yes, it will be an issue. It already is an issue.
So I have a question here, and I'm going to read the question. I'm going to have a little comment after. It says, a lot of people are having oxygen depletion due to mask wearing. I'm beginning to feel like fainting when I wear a mask for a long time. How can this be fixed? And my comment is this: I have severe asthma. I worked in an OR, and I would be in the OR for 8 hours a day wearing a mask. And it's true, you do feel there's something on your face. You can't deny the fact that there's something on your face, right? But how does that affect your respiratory system, or if it does, or if you feel that it does?
Yeah, again, I'm not a medical doctor. I know that there have been people who have said that, and what I have read is that it doesn't, again, there's different types of masks. You can imagine a mask that really, like, if you're held hostage and they bind your mouth, you can't breathe. I've been watching too many crime shows, I guess. But from what I have read, and again, I'm not saying you don't feel it. I'm sure you do think that you're not getting enough oxygen, but that's really more psychological than physiological.
This is a really good question here. Can the virus be transmitted through food? I think that's a very common question people have.
Yeah, the answer is no. Viruses are spread through, there are some that are spread through food, hepatitis A, for example. But this virus is not. It's through the air, basically.
And then are you able to catch the coronavirus more than once?
Good question. Again, virus hasn't been around that long. We do have some case studies, so single person reports of people who have gotten documented second infections. But there haven't been a whole lot of those. One disconcerting thing, however, about at least one of these reports, we thought that if you did get it a second time, you would have a milder case because, again, your immune system should recognize it, and maybe you'll get sick, but it won't be as bad. But at least in one of these cases, the second infection was more severe than the first, so that's a little worrisome. But we don't know how often that happens.
So I have two more questions, and I think we'll be hitting our time here. Is there a plan in case COVID rises up in the winter and flu season? Well, now really is when we're looking at that.
There is a lot of concern among public health experts that we will see an increase in cases as we enter fall and winter. Not so much, one of the reasons that does not apply so much down here is that up north, as it gets cold, people are going to be inside. The virus is easier to transmit inside than outside. Here, this is our nice time of year, right? So, we'll be good. But other respiratory viruses do peak in the fall and winter. It may be because of school children, and kids transmit diseases really easily. Their hygiene may not be the best, but now we just don't know what's going to happen with kids going back to school, and a lot of kids aren't back to school. And again, I'm talking K through 12. We're also not sure the effect of lower humidity on the virus. If you are, and again, down here, it's not such, I grew up north, so when the heat is on, your nasal membranes get really dried out and you can get little like tears or something, you can get nosebleeds, and it's just easier for the virus to enter. So there's a lot of concern about what's going to happen. There's a lot of concern about flu happening at the same time and really overwhelming our hospitals. And that's why you all need to go and get your flu shot. There's concern about people having both flu and COVID at the same time and what that might look like. I think we can say not good. So the plan, you'd have to ask the politicians. We'll just have to see what governors are, because we don't have a national strategy. It's really up to the states, and some states have been more active in restrictions than others. So,
And this
just have to see.
Lead in for our last question, because you mentioned going back to school. I'm sorry. You mentioned going back to school, and the question is, what is the best way for children going back? What protections can the parents do for the kids, and what can they do to help their kids prepare for the classroom?
Well, as I said, that is such a hard problem. We do know, we know that kids are very unlikely to have severe outcomes from infection. There have been some unfortunate cases of children dying. It's not unheard of, but it's not common at all. The concern is that if they spread it to teachers, and I forget the percent, but a large percent of teachers are over 50, and so more at risk. Or bring it home to parents, or worse, grandparents. And there are a lot of multi-generational families, particularly in the Hispanic and African American community, which are at higher risk anyways. So that's the concern. We used to think that children maybe didn't spread the disease so much. There are some studies showing at least children of 10 and older spread it just as easily as adults. And we're just not sure with the younger kids. They certainly can get infected. They certainly can spread it. We're just not sure how easily. On the other hand, as I said, kids should be in school. It's one thing for me to teach my graduate students by Zoom. It's not perfect, believe me. I would rather be in the classroom, but it's manageable. For a first grader, so I think that each school district has to make decisions for themselves. And then there are the social consequences of somebody having to be home, and it's usually mom who has to deal with this and what that does to her career. One parent families where, the parent has to go to work. How do you deal with that? There's a lot of social consequences to not having kids in school. And I think that each school district just has to make decisions for themselves, again, based on what the disease looks like, how active the disease is in their community. Buses, you put a lot of kids on buses, there's just a lot. And honestly, I'm glad I'm not making those decisions. It's really, really hard.
And one more, we got 2 more minutes left. I want to hit on this.
All right.
It's a great question. As for side effects, are the concerns for side effects the same for the vaccine as the actual virus?
Probably not, because it's not, when you get, let's use measles. When you get vaccinated against measles, it's a weakened form of the measles virus. So you could have some side effects that look like, the real wild type measles. With these vaccines, you're not getting anywhere near the whole virus. The concern with side effects is, again, 2 of these platforms, that messenger RNA and the adenovirus carrier virus, have never been done in humans. And, sometimes nature surprises us that there are things that we couldn't anticipate happening. With the protein, the Johnson & Johnson one, with that vaccine, sometimes it's very common to have a sore arm, maybe, a temp of 99 or 100. Those are side effects we would certainly put up with. We do with other vaccines. It's, we're concerned about more serious serious side effects. And you may have heard that the trial of one of these has been stopped because of a patient, or maybe there were 2 now, who had some side effects, had a medical issue. Whether it's due to the vaccine or not is very hard to tell. People have medical issues, whether or not they get the vaccine. And that's part of the reason why we do placebo-controlled trials.
So I think we hit all of the questions, and
Great.
I want to be very respectful of your time and tell you how much I appreciate it and how much I learned from everything today. There's so much information. It was absolutely wonderful. Mrs. Belmar, if you wanted to know if they're...
See if I can. Thank you so much for coming and speaking with us today. We
welcome.
really appreciate all the information you shared. Everybody stay safe, wear masks.
Right.
Take
All
good
right.
care.
Bye-bye.
Bye-bye.